I mean, yeah, he's been on the TV for quite a while. Handsome guy. 9:47. Let's go into the
And he'll be
K-Wave.
anchoring tonight, ladies.
Ladies, hey. I don't know if he's going to be wearing gloves, but he'll be anchoring. 9:47. Let's go to the K-Wave News Zoom room. Man, Cass, I want to adjust you a little bit because we can't see your face. Do you want to
So,
turn
like,
around and
yeah.
because see the light is behind you?
So that's all we see is the glare.
Yeah. And definitely a guy with a name like Casanova, we want everyone to see you. Oh, there you go.
There you go.
That's it, Cass. We have Casanova, Cass Nakamura of the Chuukese Association of Guam joining us here on the Link the Breeze 93.9. Cass, first of all, thank you so much for your time this morning.
Yeah, thank you, Chris. Thank you, Sabrina. Appreciate it.
We appreciate you, and I just want to start before we get started. I want to talk about back when they had released some research findings on, and it was data based on ethnic group and the rate of infection for the spread of the coronavirus. I remember when I saw that the number 2 demographic was FSM, people of FSM descent or whatever, however they categorized it. You were the first person I thought to call because I was like, man, if that's true, then let's get all the FSM community voices out here and let's spread the word about awareness and, what they can do to prevent the spread of the virus. But when I called your phone, the wife answered. And she informed us that you were in the hospital and you had spent, I want to say, about a month in the hospital fighting coronavirus.
A month and a half.
A month and a half.
It's a month and a half because actually 38 days.
Wow. And you were telling me when we touched base on Friday that for about a month of that time, you had no idea what was going on. So let's just start at the beginning, Cass. Do you know how you caught the virus and then what happened after that?
Actually, Chris, by the way, good morning, everyone listening to us. Good morning, Sabrina and Chris. Actually, I wasn't aware how I get that COVID-19. But as I remember, when I came out, my wife was telling me stories of what happened. I was with several friends. We had a meeting about somebody died in Chuuk, and we were having a small meeting. I came back to my house, and I was complaining about feverish experiences, and that's when I got started to have these chills and shivering because of that situation that came to me. And I informed my wife that I want to take a shower. And I took that shower. I came out, and that's when that thing happened to me. And they quickly called the 911 or the ambulance. And that's it. I didn't remember anything from there. What I said, I'm telling you is what I learned from family members, my wife.
Right.
Mm-hmm. Did you say you collapsed after you got out of the shower?
Yeah, I came into the room, and I just that's when I start. They say that my pupils were dilating. And I was having a hard time breathing, and I just passed out. And that's when they realized that something big is going on or is happening.
Mm-hmm.
And that's when they call 911 or the ambulance.
And so you were, Cass, correct me if I'm wrong, but you were in a coma for, what, a month?
Yes, I believe so, because like I told you that time that I couldn't remember anything. What I was telling them what happened to me is from vision or like something like dreams. that I experienced within those days. And those dreams or like the fantasies that are not true. Because what I told them, what happened is never happened or never occurred. Because that's what I experienced, what I was seeing in my like dream state of mind within those times. And like I said, I came into my being the 31st, and people were asking me because that's what the nurses and those people at the hospital were testing me on. If I have any, I recall what's going on or what date it is. And that's when I learned that that was October 31st, that I really could understand what's going on or decoded what was what they were telling me.
That's when you woke up October 31st?
Yes, because those times, even though I was still awake, but I didn't remember anything because my state of mind was still blank.
Right. So when you heard that when you woke up on October 31st and they told you you had tested positive for COVID, did you, were you freaked out? Like, wondering how did this happen? Where could I have gotten it?
Yeah, I was, but I was freaked out, but not that much because I know for a fact that's why I was in that kind of state.
Mm-hmm.
And it told me that, yes, I was positive for COVID-19. And then I realized that's why I was so weak. I was so in that kind of state because I was really weak when I came to.
Mm-hmm. How soon after were you released after you woke up on the 31st? How much longer did you stay at GMH?
I stayed there for a couple of days in that room that I was in. That was in the basement or somewhere on the first floor. I don't really remember where, but that's the ICU.
The ICU.
Yeah.
And then they transferred me after 2 or 3 days. I was transferred up to the third floor, still in the ICU unit on third floor, but there's a name for that. And I was still weak. So I was really taken care of by mostly from the therapist over there and my doctor and those nurses that are trained to take care of sick person like me within that state. So I stayed on the third floor for a couple of, maybe a week. And then I was transferred up to a room on the fourth floor for some other days. I don't remember how many days. And after that, I was told that I'll be transferred up to the skilled nursing facility in Pericata Heights to do more of therapy over there by those skilled therapists
Right.
up there. So I stay for another week or so days, and on the 17th of November, that's when I was discharged from the skilled nursing facility in Barrigada Heights.
Cass, what was that like the day you were discharged? Who was able to pick you up, and how did it feel after enduring this ordeal with COVID-19 to finally be released?
Yes, I have a doctor there named Taylor. That she's the one that has the authority to release me from that place after therapists were doing their best to teach me how to breathe on my own, because at those times that I wasn't able to go home yet, I'm still on oxygen because my lungs cannot function that good to breathe on my own. So I was assisted by oxygen within that period that I was at the skilled nursing home in Barrigada Heights with careful care of the therapist and my doctor up there.
Cass, do you know, you said that you had attended a meeting before you had collapsed. Do you know if anybody else in that meeting had come down with COVID? Or
Not that I know, because to be honest with you guys, there's a tendency among our people that doesn't want or doesn't want to be tested. It's something that I want to stress out, that even though you have the symptoms or you are urged to go and test it, nobody has the courage to come up and make use of this free test.
Why is that, Cass?
I think it's part of our culture. I'd say that because you don't want to know or let know if somebody know that you are sick.
Cass, you said that you required therapy to be able to breathe on your own again.
Yes.
But in listening to you talk now and comparing it to when we spoke to you before you contracted the virus, it still sounds like you're a little short of breath. Are you? And I've read.
Yes.
Okay.
I'm still having that difficulty. I'm still if I walk a long distance or I'm doing something that is within my ability, then I start to have this breathing thing.
Wow. This is something I read about.
I'm not yet really fully recovered from this breathing because what I was told that my lungs were really crumbled up. So that's what they were trying to do when I was at the hospital at the skilled nursing home. They let me lay on my chest for a long time. Most is like 3 hours. And there's a breathing exercise that they told me to do, like, they told it sound like this. Smell the roses and blow out the candles. Breathe through the nose, in, and exhale through the mouth. And like I said, this is what the exercise I've been going through. To lay on my stomach for 2 or 3 hours, so that it will help the muscles of my lungs to return to normal. But I don't think they're not yet really 100 normal, my lungs, because I'm still having this kind of shortness of breath when I'm doing heavy task.
Cass, have you
like
been able to return to work yet?
Yes, I'm still at doing this work through this means, either by phone or by Zoom. Yeah, that's what we're doing right now at my work.
Yeah.
either by the through the judges or the attorney's office with several of my clients.
Right. And those of you who don't know, Cass is an interpreter for the judiciary of Guam.
Cass, what about your household? Is it anybody else had to be
Yes, yes.
tested?
All
or-
my household members were already, when I left for the hospital, that's the requirement for my household members to be tested. And they were in isolation. Those that are tested positive, I was told that they were in isolation in our homes until they were tested negative again. Everybody in my household go through that process for being tested, and now mostly all of us are COVID-free or tested negative.
What was it like to see your wife again after having been in the hospital for nearly 2 months?
Let me tell you, Chris, that it's a great relief and lifted a heavy burden on myself and my being. I was able to talk to them because I have a phone that was given to me, and I was able to talk to my family members when I was up at the skilled nursing home. But sometimes I was given the opportunity to go through messaging my family members through a Zoom or on a phone that was given to me by the administration or hospital staffs. But I didn't quite remember everything those times that we were having this opportunity to talk with my family. But like the answer to that question is a great relief and a lifting of a heavy burden on myself to be able to come back to my family. It's a miracle, my God, that I was through the valley of death, but I came back. I've been telling my people at the church that through the miracle of God and His unconditional love, and through the diligent prayers of my followers and believers, that I'm able to recover.
You sound
It's a
like
miracle.
you sound like you were really scared there, and your family was really scared there.
Very much. Because everybody thought that that's it, I'm not going to be back, because there are 2 others during that period that I was there that didn't make it back. Same age group as me from my island in Chuuk. Same, we were also from the church. And most of them, or 2 of them didn't make it back. Like that's why I say I am very lucky through the grace of God that I'm able to come back to my family.
Amen. I know God definitely did His part, but I have a feeling you also want to thank the staff at the Guam Memorial Hospital.
Yes, very much, because those that helped me, I have several friends within the community that keep on urging if they know anybody from the staffs of the hospital to really help me out, take care of me, because that's true. It is with the help and hard work of staffs of the healthcare community on Guam that I'm really able to come back.
Cass, I know that it's a lot for you to talk to us for this long, but I wanted to just ask you before we let you go. You talked about, and you sounded frustrated about it, people from the FSM communities not really wanting to get tested for the virus. We did see some outreach. Right?
I've been telling this is what I've been preaching at my church, that we have to comply with this. It's a free opportunity for us to be tested. I've asked whom among you have been tested, and even that time nobody raised their hands, either by their scared to do so or telling that they didn't tested yet. So the answer was none.
How can we?
Did they say why?
I know for a fact that each, like I said, it's part of our culture that you don't want to tell or show that you are a sick person. It's part of our culture. Even though you're sick, you don't want to admit it or go seek help. So the consequence is we're not helping ourselves. Even when I ask them, because there are three things that we have to comply with in our community. Wearing this face mask, apply the social distancing, and wash daily your hands. No, like if we are 50 in the group where our church is, maybe only 20 wear face mask. The rest don't. Where is your face mask? It's at home. It's in the car. Those are the answers we get. So these are the kind of life we have toward compiling with the rules and regulations of our place, Guam. In fact, just last Sunday, we came to our church. The church capacity is 29 according to law. So I was telling them that we have to comply with that, but people came in without face mask, more than the 29 that the place could accommodate. So after maybe 1 hour, GPD was there because somebody called and tell them that we are in violation of the social gathering. So after that day, because I came out and GPD was telling us or me that we are in violation, we would be fined. But they were just giving us chance to comply with the executive order. So after that we don't meet at the church anymore. We are having our church services at our own house with the family members. Like me, like last Sunday, I conduct church in my own home or house. And the other pastors from our church are doing that same thing at their own house. We're not meeting at our regular church up in Barragada anymore because of that.
Yeah, it's frustrating because this is a time, Cass, where we're definitely seeing a lot of people who need the faith, who are rekindling their faith. I mean, I've definitely prayed way more in this pandemic than I ever have before in my life, and so people are yearning for that.
Yeah,
that calm,
we
right?
are not going to celebrate Christmas as usual. Everything that we planned for Christmas, were temporarily canceled
Right.
because of this situation or that time that GPD was visiting our church.
Cass, we want to close and give you the floor. If you want to give a message out in your language or whatever language, just to anybody out there who you feel needs to hear it. We'll go ahead and give you the floor, and you could do that, Cass, before we let you go.
Okay, thank you. I think the population of our people understand English, mostly our young ones, even some of the older ones, because the population of our islanders here, we've been here for a long time. So I would like to tell my fellow islanders from Chuuk, even from the FSM community, that we have to comply with all these regulations that it's been out with us. Get tested to find out if you are sick or not, because as we know that you won't experience the symptoms that you have this COVID-19 in you until it's too late. These testing sites are available to us, are free. Don't be afraid or scared to know that you are sick. Even though, like I say, each part of our culture, please, I beg of you, get tested, make use of these free opportunities for us, because it will save your life and your family. I'm lucky that I came back, but who knows? Apply what is required for us to be tested. Wear your face mask, apply social distancing, and wash your hands daily. Apply personal hygiene and use common sense. Thank you, and Kirisok Chabur to everyone listening. I'm not saying this to force you, but it's a must that we are doing this. Please, if you love yourself and your family, do it. Thank you very much.
Amen. Thank you,
Thanks,
Cass.
Cass.
So good to hear from you. So glad that you're standing on the other side of this virus. And you're right. I think it's a miracle. And I'm glad that you're using the opportunity to spread the word and raise awareness.
Thank you. Thank you very much, Chris. Thank you very much, Sabrina. And thank you very much, whoever is listening to us.
God bless you,
God
Cass.
bless
Merry
you all.
Christmas.
Yeah, God bless you. Merry Christmas.
Merry Christmas.
Yes.
Happy holidays.
To you and your family. Pound that corn for me, my friend.
Thank you.
Thank you, my friend. Good luck. God bless.
care.
Thank you.
Esther.
Okay, take care. Bye-bye.
Okay,
Bye.
bye.
Okay.
That's the Cass Nakamura, the Chuukese Association of Guam, impassioned plea there. He said he walked through the valley of the shadow of death, came out on the other side, and it's a miracle. But, you know, I like what he said there at the end. Who knows? That's how it worked for him. But who knows how it could happen for you. 10:15. Good job today.
1 month, right? 1 month.
Yeah,
in a
1 month in
coma.
a coma.
38 days, he said.
Yeah.
And he also said he considers himself unbelievably lucky.
Oh, that is
Yeah.
beyond luck. And let me tell you guys.
Said it was a miracle.
Yeah, that's beyond luck, because we hear from Lillian. I mean, people who get as sick as he does, they don't make it. I mean, he was in with two other of his countrymen, and they both lost their fight. So thank you so much for that. What a way to close the show. Good job today, Bree.
Good job.
Jason, the star of today's
I don't know.
episode.
Well, we have not
Can
shown
you
our.
take us out with a song?
Well, no, I was gonna say, you know what would be great to take us out?